Hello, my name is Dr. Johanna Ward. I'm the Medical Director of the Skin Clinic. I'm a GP with a special interest in dermatology, minor skin surgery and cosmetic medicine. Rosacea is a common dermatological problem. It is thought that rosacea affects about 145 million people globally. The thing about rosacea is it's actually commonly misdiagnosed. People often think that it's acne or some other kind of skin or cutaneous disorder. In fact, a lot of people who have rosacea don't even know they have rosacea. Rosacea primarily affects people of a fair complexion or skin type, although it can be seen in darker skin types, and it does seem to affect women more than men. We don't fully understand what causes rosacea, but we do know it's an inflammatory skin condition, and there is an abnormality of the facial blood capillaries that causes them to flush easily and respond to triggers. Triggers are simply anything that makes rosacea flare up or worse. Most people have their own personal triggers, but the common ones include alcohol, spicy foods, hot and cold temperatures, hot beverages, and it's not the caffeine in the hot beverages but the temperature of the beverage, irritants onto the skin and sun exposure. It's very important for anybody with rosacea to avoid these triggers. The most important thing about rosacea is getting the diagnosis right. I always try and educate patients to allow them to understand that there is no cure for rosacea as such, just treatments that can help reduce the severity of symptoms. Rosacea is a chronic and progressive inflammatory skin condition. One of the first things I try to teach people is the importance of good skin care. For example, a good simple cleanser will help. The other thing with rosacea is it's very important to use some quality skin care. Anti-inflammatories are very helpful in the skin, and antioxidants. Here in our clinic we use a range called Image Vital C, which is designed specifically for people with rosacea and dehydrated and inflamed skin. The anti-inflammatories and the antioxidants can help calm the skin and help reduce any redness. The other really important thing in rosacea is to wear a really good SPF or daily sunblock. It's important to protect the skin from the effects of the environment. And the other thing, obviously, I always advise people to do is to avoid triggers. Other treatments for rosacea include using things like metronidazole gel topically to the face, although I do find that some people find this quite irritating. For the papular kind of rosacea, and that's the rosacea that presents with little spots on the face, antibiotics such as doxycycline or tetracycline taken orally can be very helpful. For the kind of rosacea that's characterised by a lot of facial flushing, redness and broken capillaries on the face, I find that intense pulse light at a certain wavelength is a very helpful treatment. Certainly there's a lot of good clinical data to support the use of intense pulse light or IPL for treatment of rosacea. It is particularly this kind of rosacea, the one characterised by easy flushing, that can be very difficult to treat, so it's definitely worth trying intense pulsed light. In conclusion, really, rosacea is an inflammatory skin problem. We don't fully understand why rosacea occurs, but we know that it is a very common problem. We know that it's frequently misdiagnosed and that there's a lot of people out there with rosacea who don't even know they have rosacea. Really good skin care is essential for people with rosacea. Trigger avoidance is also very helpful, and of course things like oral antibiotics and intense pulsed light can be very useful for people who are suffering with rosacea. If you would like any help with your rosacea or have any questions, we would be happy to hear from you. I look forward to welcoming you to our clinic.